jokingly or being mischievous, we pick somebody's body parts and we rain insults. For some, it doesn't go with them. Myself, I've received several, but I'm used to those who know me. My friends tease me with how my pot belly looks like, and I laugh. And this teasing has started long ago before now. But for others, they cannot deal with it. And of course, it also impacts on how we feel about how attractive we are, our body esteem, how we value our body shame, we want to show our body to others and all that. These are all issues associated with our body image. And for others, it has gotten to that point that they say, I don't like the way they look like. And for that matter, it's impacting on their mental health. That is the discussion that we are going to do today. We'll find how it has resulted, and most importantly, how they can help themselves. And in fact, this is not a male thing or a female thing. It's both male and female. Yes, the statistics and research has shown that it impacts more on female than men. That for female, they have their body image psychological worsen between the ages of 10 and 16. So for us as parents, if you have a daughter between that age, you need to be careful when you are talking about her body. And it gets better between the ages of 16 and 24. That's some research by some colleagues. For males between the ages of 10 and 24, it fluctuates, but it's better than the female. So we are going to discuss and see how we can help. So it's not for us alone, but for our children and for our siblings and all that. Everything that we do here, that's the essence of it. So let me introduce my facilitators for today. Ladies first, so I'll introduce the lady among us. Dr. Carol Matthias Oshes. She's an educational psychologist, works with the Thrive Care Ghana, and through her institution also works with the mental health youth space. Dr. Carol, are you there?
Yes, I'm here. Good afternoon, sir.
Good afternoon. Good to see you.
Thank you. It's good to see you too.
Good. Our next facilitator is Dr. Jonathan Odame. He is a clinical psychologist as well as a lecturer a senior lecturer as that, as well as a clinical psychologist at the University of Ghana, Legon. He is a licensed clinical psychologist with over 15 years of clinical and professional experience, a senior lecturer at the University of Ghana, Department of Distance Education, so much interested in mental health and education. And he's not a new person to this platform. Dr. Damin, how have you been today?
Thank you very much, Dr. Atta. I'm being so fantastic by the grace of God.
Good. Our next facilitator, if you took particular notice of the flyer, our next facilitator should have been Gloria Egwazi. Thank God she's in good health. This morning, unfortunately, she had an accident, but she's in good health. She's alive and well. That is why she's not able to join us. So I ask all of you to pray for her for good health for her so that next time she'll be able to join us. Luckily, we have another well-known person on this platform, Dr. Isaac Newman Arthur. He is the medical director and clinical psychologist at the University of Professional Studies, Accra. He's also the PRO for Ghana Psychological Association, a part-time lecturer at Family Health Medical University, Central University, and Daniel Institute. He's no stranger to this platform. Ike, so for us, him and Dr. Dami and Martin, they are all veterans to this platform. So we will go by first names, and that is fine with us. Ike, how have you been today? In fact, I have to pull Ike out of a meeting to join us. And he's also always ready to support me in this exercise.
You will pay. At the right time, you will
pay. How have you been today, my brother?
Stress, but it's okay. Obey.
Good. Obey. Right, let me start with you. I did a brief intro about what body image and all that. So what is body image and how does it influence? What influence our body image?
When we talk about body image, basically we are looking at a person's perception about his or her own body, how they think about their body and how they feel about it. And it's maybe some characteristics of their body. So we're looking at the person's size, whether they are too big or too small, or even if it's average size, they may still have some problem with it. Then the shape, how it looks like. You may look at the head, look at the trunk, the hips, the legs, and various parts of the body, the shape of it. Then again, to how it is attractive overall. So you look at the attractiveness of it overall. And that attractiveness of it is dependent on what is societally acceptable or what they themselves think is acceptable or not, right? So this is the basic thing about a person's body image. So it may be a positive body image or a negative body image. And so when people have a very negative perception about themselves and they feel negative about themselves, then they may have a body image problem. And it actually affects every aspect of their lives. And I'm sure that is what we're going to talk about. Yes.
Great, fantastic. So, Dr. Damin, Alice, social media. Social media is causing so much. It has its good side and has its bad side. And for our children and our adolescents, how has social media impacted on their perception of their body image?
Thank you very much, Dr. Atta. And I want to, since you said this seminar is our first seminar, I want to wish all of us a happy new year. And I pray for God's blessings for us this year. So in terms of social media, how social media has impacted body image for people, and especially the youth, I believe that most of the time, let me look at it from unrealistic standards that social media may tend to bring. You see, sometimes people go to social media with zero expectations, or they have some level of expectation. They see people on social media and they're like, wow, I wish I was like this person. I wish I had the shape or the body of this person. But oftentimes, of course, most of the time, most of the pictures that people may see on social media, and if I say social media, Facebook, Twitter, and the rest, some have been photoshopped and some have been edited images. So people look so perfect in those images. And these tends to affect people or the youth because of that unrealistic standards that have been set outside. So most people, when they go on social media, there's a term called comparison trap, where people compare themselves with the bodies of people who they see as influencers, who they see as celebrities, and who they see as role models. So there's that toxic trend where people want to do certain surgeries, plastic surgeries. They want to do a lot of exercises. They want to do a lot of extreme workouts because of what they see on social media. So for instance, a young boy who is like 18 years, and I like what you said, the statistics. You said that research has shown that 10% to 24% of the youth are being influenced by social media. So for instance, a young boy sees a fitness influencer with 6 packs all over the chest and the body. And the person will be like, as for me, I don't have this kind of body. And what is happening? So you see, that perception that every gentleman or every guy should have a 6-pack tends to influence the person's self-image or self-concept. And that is social media. Or a teenage girl watches TikTok. You see, sometimes when you go on TikTok, people are doing all kinds of advertisements. How to lose weight, there's a tea, there's a meal, there's a medicine, and there's that. And people will tend to starve themselves so that they will look thinner or they will look younger. So in this case, social media really has an impact on people's image, especially among the youth. Thank you.
Thank you very much. So, Dr. Carol, for you to top it up, I think that with this perception, we've been behaving in certain ways that has become routine. People see it as a norm. It's like exercising too much and others. I want you to spell it out for us. That we've seen it as a norm, it has become routine, but which invariably is risky and they are unhealthy. Can you expatiate more on that for us?
Thank you very much. I think Dr. Adami started to hit on a couple of them. I think
Yes.
definitely a lot of what we see now, there are all kinds of concoctions and detox stuff that you can drink, and we have no sense of whether or not they're actually healthy, whether or not they're actually effective, what dosage, what the ingredients are, but you see them advertised all over the place. People drink them, quite like it's nothing, like it's normal and we've accepted it, but we actually don't know the harm that is doing to our bodies. And the other thing that we are seeing quite a lot of has a lot to do with intermittent fasting, and I know there are a lot of people who take this intermittent fasting trend to very unhealthy extent, but that's also something that has become quite normalized almost, in terms of just this idea of skipping meals as a way to kind of to lose weight or to look a certain way. Another thing that we are seeing a lot of, also a lot of diets, different diets that are popping up constantly, where one specific diet where you don't eat, for example, no carbohydrates at all, and understanding how the body works and the needs that the body has. We know carbohydrates, it plays an important role. And it is just an issue of balance. But you have these diets where people are encouraged to cut out certain food groups and nutrients altogether. All of those things are things that have become quite normalized, but that are in the long run can be quite unhealthy.
Thank you. So these are the things that we need to be conscious of, that we think that we are using them to address the perception of the image that we have with regards to our body. And so it has become normalized. Like you're saying, advert is being made, slim tea, detox, dieting, avoiding the carbs and all that. But invariably and in the end, they are risky and unhealthy to our system.
Yeah, let me add one more that I
Okay.
forgot. It has to do with skin, this idea of skin toning, and
Bleaching.
bleaching essentially, but we're calling it toning. And this idea now that you have to do everything to ensure that, I think they sell it as making sure that your skin tone is even, but eventually for a lot of people, what happens over time is that it lightens their skin. And so with a lot of the soaps and the creams that are advertised, and it's become quite normal, because you'll see even big billboards all across Accra, advertising creams that are obviously lightening people's skin. So I think that's something else too that I think has to do with body image, that has become quite normalized.
So we need to be careful about this normalized behavior that people are even applauding. because this billboards, and so you enter somebody's bedroom or a friend's bedroom, she has this expensive cream for toning. Invariably, she's killing herself. Let's get into it. Ike, body image and mental health. What has happened so much that people's mental health has been impacted as a result of their perceived poor body image?
So when it comes to even knowing whether someone is mentally healthy or not, there are 6 functional areas: ability to cope and adjust, form and maintain meaningful relationships, contribution positively to society, independence, and all kinds of. One of them, in terms of a person's assessment of a person's mental well-being, is the area of a person's self-perception. It's also one of the aspects that we look at when it comes to someone's mental well-being, right? And there are multiple things that influences that and impacts a person's mental well-being. So the first one I will talk about is childhood experiences. Any negative childhood experience can affect a person's self-perception. And particularly for parents, significant others, kids form their identity based on affirmations from significant others. So you have a parent who uses body parts to insult a child. I remember we had an intervention for about 40 kids in the Eastern region who had had some suicidal behaviors over the past 2 years. And one of the girls said that she's 10 years, said that 2 years back, she did something at home, and the father insulted her by saying that your face looks like an animal. Also, right? You don't say those things to kids. Even when you say those things to an adult, you see how we even respond to that. For kids, they internalize it. It becomes part of their identity. So adverse childhood experience, particularly with words and the things that are common thing in our environment, where we use a person's body parts to insult them. I remember there was another person, 21, can't even do presentations in the university. So anytime there's a group presentation, he'll always be hiding because they've always insulted him with his body parts, and so he actually feels very, very shy and anxious standing in front of a group of people. So childhood experience and abuse, any form of abuse, physical, verbal, emotional abuse, sexual abuse, has a way of damaging a person's self-esteem and identity. Bullying in school. I've had clients who have been bullied because of their size in school, and that has really, really affected them. And then again, I think we talked about undesirable, body, qualities by the society. So you have a certain beauty is defined in many ways by society. There's this African town, I've forgotten the name, I think it's one of the countries, where having a pot belly, and not the Ghanaian type of pot belly, normal pot belly. The bigger your pot belly, the more attractive you are, and the more likely you find a mate. And so if you are in such an environment, you may think there's something wrong with you, right? And in Africa, we have a way of defining what beauty looks like. In Europe, you have a way of defining what beauty like. Those kind of definitions can affect a person. There is also a lot of research that has been done about obesity, and even when it comes to childhood developmental delays, intelligence issues, autism, and stuff like that. And realize that body image may even be as high as 81%. Image issues as high as 81%, amongst people who have some kind of intellectual problems. Then again, to diseases, things like people who are going through some form of disease like cancer, issues with obesity and all that. People who also have some nutritional problems like anorexia, bulimia, nervosa, and those things. They are all risk factors for stuff. And again, disability. Anybody with some form of disability. So maybe they have some physical disability, that also influences things in value. And also pain. When people have chronic pain, they assign pain to a certain image, and they actually have a certain focused attention on that particular part of their body that is painful. And they may actually, have some body image issues regarding pain, or some, there's someone I know who has lower back pain, pelvic pain, and lower back pain for years. And that is even affecting mobility and stuff like that. And because of that, he's always putting on some form of weight. So the factors are multiple, and the impact is enormous. The impact is enormous. It affects the person's self-esteem, the ability to navigate a relationship. There are some people who have decided not to even have some level of relationship because they are afraid of the comments and whatever people will say, the spouse will say about their image. It affects the pursuit of their goals in life. Some people will decide not to pursue certain courses, certain professions, just because of how they see themselves. It affects their relationship and also promotes some conflicts in the relationship. Then on the level of mental health, we look at anxiety disorders, depressive disorders and all that, body dysmorphic disorders and those things, right? So every aspect of a person's life, it affects the person, right? So for us in clinical practice, when we are talking about weight loss, there is a way we talk about it. We talk about weight loss for the fact that it is unhealthy when someone has obesity, not based on image issues. So we don't tie image to obesity. We tie health issues to obesity. So for example, when someone comes to me in the consulting and has a problem with obesity, what I say is that lose weight not because it's not nice, but lose weight because it's unhealthy. The moment we pair an identity with a person's body structure or form, then we are creating problems, right? Then we are creating problems. So it's always good to be able to have a proper way of even addressing issues like that. Otherwise, it may compound the already existing mental health issues that the person may be facing, right? So these are some of the issues when it comes to, and the body actually, and let me make this statement about even teenagers. There are three things that characterizes the adolescent years when it comes to the adolescent growth in terms of mentally. They develop their own world views. And what is this life about? They develop their own identity. Who am I? And also they develop independence. Those three things. So you realize that identity issues are a big thing for what you call adolescents. And depending on the affirmations and whatever they have received at home and the level of care they receive at home, it either makes it worse or not. Thank you.
All right. Thank you very much. Dr. Carol, would you like to add something to what Ike has said?
No, I think he's covered it all. I think he's covered the very extensive impact that body image has on mental health issues, and I really appreciate him touching on the teenagers especially, right? Because it's a big transitional period. Like he said, identity development is really front and center at that time, and so is body image sort of like development at that point, because at that point for teenagers there are a lot of things happening with their bodies. Like there's a lot of changes going on with their bodies hormonally. And so how we help them navigate in terms of building a relationship with their bodies and the changes happening with their bodies at that time is really, really important, right? Because for a lot of adults, if we look back at teenage years, especially with regards to how we felt about our bodies, the changes that were happening with our bodies, that's where a lot of issues of attraction and how desirable you are, to the opposite sexes, and awareness that, starts to come on the scene that isn't necessarily there when you are a child. And so the teenage years are very, very critical when it comes to body image issues.
All right. All right. So body image and mental health is not as simple as we say. It comes in all forms. And Dr. Dami, how far, to what extent can the impact go? Because I've seen this documentary, Botched Surgeries, and people go to have surgeries to change certain parts, and it gets horrible, and they still go. People are bleaching their skins. So my question is, to what extent can body image impact our mental health? To what extent? How far?
Okay, thank you
How worse can it get?
Yeah, thank you very much. And I want to comment on what Dr. Newman said and about when he mentioned obesity. A study had been conducted just last year. That was 2014. And the study was conducted in Kumasi. In fact, the study is online, so we can all have access to the article and read. And it's so fantastic. The study was looking at the impact of body image and perceived stigmatization on the psychological well-being of obese women in Kumasi metropolis. And the findings indicated that most people felt that it was good to look very, very big. Because if you look big, in fact, from the study's findings, in our Ghanaian culture, being bigger is often seen as a good thing. So people believe that a larger body means the person is worthy, the person is healthy, the person has so much money, and the person is being taken care of. So because of these cultural beliefs, many obese women in Kumasi do not feel bad about their bodies and are comfortable with their sizes. So this even tells us reasons why people may tend to be obese, may tend to eat very, very, very well to become so big. I know also in our Ghanaian culture, okay, of course, this is a comment I want to pass. When a lady gives birth, it's expected that she eats very, very well to get breast milk for the child. And this may make a lot of women to gain more weight because, of course, if the lady doesn't eat well and doesn't look fresh within that 3-month period where he or she is on leave, people will be like, ah, is your husband not taking good care of you? So the culture in which we find ourselves also precipitate us to eat more or to look big in appearance, and it also has its own implication. But what you asked, you see, a lot of factors comes into these things when we want to look at body image and self-image. But we have to understand these concepts so that we can really have a very, very big picture. You see, we have what we call self-esteem, we have what we call self-concept and self-image. The way you believe you are, you get it, it's your self-concept. And that pictorial image that you have is that image about yourself. So I believe I am strong. That's my self-concept. You get it? And I see myself as responsible. That is your self-image. And how you evaluate that tends to affect you. So you realize that most of what we are saying is looking at the impact it has on the person. And that will look at the self-esteem. And that is where the mental aspect would come into place, where people would tend to be like, when I look at myself in the mirror, I am ugly. I have a friend who was like, Jonathan, I don't want to take a selfie picture. I don't want to look myself, I don't want to look at the mirror because when I look into the mirror, I see that what? I am ugly. So such a person will be forced to go and do a surgery, will be forced to go through all kinds of medications or all kinds of treatment just to regain that look he or she thinks he has to look. And that is where people would be like, okay, fine, let me go to Italy, let me go to Turkey and the rest to do all this plastic surgery because they want to be accepted in the society. For instance, you might have a girlfriend or a boyfriend who tells you that I like ladies who are fat. As when Dr. Carol was talking, he was talking about bleaching. Some men likes women or ladies who are fair. Some men likes women who have some particular shape. So that pressure, even from your spouse or your relationship, can force you to do certain things that you don't want. In fact, about 3 months ago, I had a case of someone that I was looking at, and that person had dysmorphophobia, which is a condition, fear of body image. It's part of the somatoform disorders. The person feels that he looks ugly. Everything shows that he's beautiful, but she thinks she looks ugly. Such a person would spend every money, everything he has to do just to please people and to look beautiful. So you realize that most of the time, the thoughts that I am ugly, I am not beautiful, people are teasing me, people are doing this, people are doing that, is what may let people to do all kinds of things. For instance, I had a friend who wanted to get married in January, and there were issues with the marriage, so it was extended to March. So the person had to wait for 2 months. And at that time, she had already sewn her wedding dress. Do you know what she was doing? She was fasting so that she wouldn't look big in the wedding dress, to the extent that she even started developing ulcer, and she had to put a stop to it. So such a person wouldn't mind going to do surgery just to fit in the wedding dress and to look so nice. So these are things that people start to think about, and it will predispose them to go to do all these kinds of surgeries and the rest. And we also know that nothing is perfect in this world. Everything has its own consequences. And one day people may regret, because sometimes these surgeries too comes with all kinds of restrictions and even all kinds of medications that the person must take. So the thoughts, how people are seeing me, how I see myself, am I being accepted? Am I looking nice? Am I looking this? Am I looking that? Is what would let people go to the extent of saying that I don't like the way I feel. I feel I should be like this. I should be like that. For instance, I have a friend, he's so skinny. He always wear big dresses. I was like, why don't you wear your size? Jonathan, if I wear my size, people will see me as a small boy, as a secondary school boy, but I am old. So for instance, you see such a person, because of people's perception, he now fills his wardrobe with big dresses just to look pleasant in the eyes of people. So all these things are things that would let someone go to the extent of doing a plastic surgery to feel acceptable and accepted in the society. Thank you.
To starve themselves and all that. Ike, would you add something to it?
I think it's fine. I agree with whatever he said.
Yeah.
Yes.
Because it's kind of horrible. Let me read a few comments that have come in, and others could also share their comments. Nadia Nokwe, she's saying it's getting out of hands. Yaria Zozegbe, sometimes our colleagues tend to question how you look, if in case you are growing fat or lean. Some of these things. Patience Ejari Kwabi, the proliferation of so-called beauty plugs, which market beauty-enhancing products, influences negative body images. Sharon Kwashi, Doc, can you please repeat the 3 things you said the teenagers develop? The 3 things. Ike, was that you?
Yeah.
Maybe.
It was me.
Okay. Bernard Akwai Jackson, hello. Can the links to such articles be shared in the act? Dr. Dami, somebody will be interested that you share the links to the
Yes,
articles.
please. I'll put the link there right now so that people can read and
Okay.
get more insight.
Okay. Nina Blankson, some of us are body shamed, even with the texture of our voices being tiny as compared to societal acceptance of voice tone. Don't be ashamed, Nina. Don't be at all. The most important part of this conversation is helping ourselves. So let's get to that, because we have.
Well, let me answer.
I
think the person asked about the 3 things,
The 3 things, yeah.
The 3 things, yes.
So I said development of worldview, the person's worldview. What is this life about? Identity, who am I? Then again to independence, worldview, independence, and identity. Those 3 things. Yes. I think Dr. Ata is, we've lost him, right? So just to add a bit, I've realized that when it comes to relationships, when people have entered relationships and they've received negative comments about their body from their partners, it influences behaviors that Dr. Odami talked about. So there are some women who think they are not good enough for any man based on how they look, and it may be a product of some past relationships that didn't go well, and comments made in those relationships. And for example, pregnancy changes a woman significantly, because of, baby issues, surgeries and all that. And so sometimes if the person's spouse, the way they comment about their bodies, they no longer do that, You know, it may affect their self-perception about their image. It looks like we've lost Dr. Dr. So, moving on, Dr. Odami, if you could throw more light, if someone is going through something like that, what should the person do in order to be able to improve on their perception about themselves? What should they do?
Yeah, thank you very much, Dr. Atta. So what should they do? You see, you should focus on your health and not your looks. You get it? Because you see, you can't live your life to please others. You can't live your life to please people. And I like what you said when you used the pregnancy as an example. A lot of women, when they get pregnant, some of them, even it affects their skin color. I had a woman who, after pregnancy, was having some stretch marks on her thighs. Some women even get rashes and the rest because of childhood complications. And I know some women also who, after childbirth, they have big bellies, big stomachs. And some women, to that extent, would even be wearing corsets so that their stomachs will become so flat. You'd see change is inevitable. We are all growing. You see, that one is nature. As you grow, as we age, there'll be wrinkles on our bodies. There'll be like this, there'll be like that, there'll be like that. So you have to accept nature and move on like that. But where you want to focus only on your looks and not your health, where you are not even eating well and the rest, and you want to please others, it creates a problem. I had a woman, for instance, who was telling me that the husband is always telling her to wear high heels. And one time he wore high heel and she slipped and she broke her leg. And the same husband was consoling her, telling her, I'm sorry for everything that I put you through and the rest. So you see, we should focus on our health and not to really please others. And again, we should also, of course, I know we'll get to that. We should not be so much into social media and what we see most of the time. In fact, when Dr. Atta gave me this topic, I was like, people put nice pictures upon themselves. But please, excuse me, this is a seminar. Who will put a picture of him or herself, please excuse my language, in the washroom, on the WC, on social media, in constipation? You see, when you're in constipation and you want to release yourself, look at, even sometimes some people scream in the washroom. Will you put a picture of that on social media? No. You see, so what we see may not be the reality. In fact, even by my picture on that I sent for the poster, you see, I had to tell one of my students that, Charlie, this is a high-profile seminar. I want a very, very good iPhone. And they gave me somebody who has a very good iPhone to take a very, very nice picture. And I said, please, I'm very, very dark. But on the picture, let me look a little bit fair. So somebody will see me, hey, this doctor is so fair. But in reality, I'm very, very dark. So what we see outside may not be the realities. So please, let's be ourselves and be happy about the way we look, and we will not have any kind of mental problems affecting us. Yeah, so Dr. Atta, please, you can continue. Thank you, Doc.
Thank you very much. Technology did that thing.
Yeah.
So I dropped off, but I'm back. Walanyo Nani is saying that, Ike, you are too fast. Kindly repeat the three things.
The person will send me Momo for repeating myself all the time.
For repeating yourself, Walanyo, send Ike Momo after here.
And so identity, independence, and worldview. They develop their own worldview. What is this life about? 2, who am I? Identity. And 3, independence. They want to be by themselves. And unfortunately, parents don't get that. So they become more combative with their folks. Right. And that is where even because of these 3 things, that is where peer influence will go up. So when you go to various secondary schools and stuff, realize that they are in certain groups, and those groups have similar characteristics because they have accepted themselves and they understand themselves. So those 3 things are important: worldview, identity, and independence.
Okay, he's noted now. Anobia says, my mother said my arms are big when I was 15. I am 21 and it still affects the way I dress. Esther, now I'm also going through this problem, but well, let's have a solution to this. Let me start with you, Carol.
Yes.
We need to undo this perception of poor body image.
Right.
We need to undo that. How do I build positive body image for myself?
Thank you. That's a great question. I think maybe one of the things I want to highlight a bit is there might be people who are listening to this, and even though we've given some indications, there might be people who are wondering whether or not they have a body image problem. There might be people who are, wondering whether or not they have a negative image problem. And I think in order to be able to address it, you need to be able to name the thing, right? So what I would ask people to think about, some questions to think about is, like Dr. Arthur said, whether or not your feelings about your body interfere with your relationships, your work, your daily activities, right? Whether or not you find yourself doing extreme measures to avoid seeing your body. The people I know who won't walk past mirrors, or when they walk past a window, they don't want to look at themselves. If you find that you're compulsively checking and rechecking your body, constantly checking your weight, or constantly even examining yourself in the mirror, even for some ladies, there are some ladies who wear excessive makeup all the time, even to just run an errand from their house to the supermarket. They can't step out of the house, or they can't allow anybody to see them without makeup. Do you find that you are always trying to cover different parts of your body? Like Dr. Aldame said, are you partaking in excessive plastic surgery? Do you use harsh and unkind words to describe your body, right? Or do you find yourself sometimes intentionally even damaging your body? Do you experience negative emotions when you think about your body? These are all indications that maybe your body image is in an unhealthy place and you need to do something about it. And so I think it's important that we think about it. We approach this in two ways. If somebody already, is at a certain age and they realize, maybe through this conversation that, well, my relationship with my body isn't healthy, there's one way to approach it. But I also think, like you said, because there are parents on this platform, I think I want to start by answering, for example, what can we do as parents or adults or as a society, when we are thinking about as children are growing up, how we help them develop a positive body image, right? And like Dr. Arthur said, it's about the things that children hear, right? Here we have somebody sharing that she heard something at 15 and it still impacts her today. So we have to be intentional about what are we constantly communicating to children explicitly and implicitly, right? Some people directly, yes, insult children with their body parts, but sometimes children too are just listening in on conversations, right? And picking up on different things that they hear that give indications, for example, about what society's expectations or standards of beauty are. Then they look at themselves and they compare and they realize, oh, I don't fit this mold, right? That can impact their body image. Also, representation is important, right? So we are talking for adults and teenagers, we're talking about social media, but even for young kids, right? The kind of cartoons they watch, the kind of dolls they have access to play with, right? Are we exposing them to things that really are a fair representation of who they are? When they look at the cartoons they watch, do they see little children that look like them? Right? What messages are we sending to them about what they look like by what we're exposing them to? So all of those things are important. So in our homes, in our schools, in our churches, whatever religious organizations, communities we belong to, how are we speaking to children about the way that they look, right? And also, what things are we doing to encourage them to feel positively about their body, right? Are we affirming them? Are we teaching them to affirm themselves? And then if this is somebody who already, in adulthood, you realize you have and it's important that you acknowledge that this is the problem. You can't deal with something until you name it, right? So being intentional about naming what it is that you are dealing with. And then in addition to starting to do things like appreciating your body, being around people who have a positive relationship with their body, checking how you're talking about your body, affirming yourself, redefining beauty in different ways. It's also important that you find what the source of your negative body image is. Because if there's, like Dr. Arthur said, if there's some trauma linked there, and it doesn't matter what you do to your body physically, you will still feel the same. With a lot of people who are dealing with body dysmorphia, for example, they may lose weight, right? They may have the surgery and go from being a size, 22 to a size 10 or 6. But when they look in the mirror, they still see themselves as, the person they used to be, which tells us that then they haven't dealt with the deeper psychological issues that are there. So it's important that you figure out, okay, what is the root of why I feel this way about my body? Was it something I experienced as a child? Was it something that was said to me? Was words that were used against me? And it's important that I start to deal with that trauma and work through that trauma in addition to, redefining what beauty is. And then the important thing is also focusing more on the function of our bodies versus the way our bodies look. Right? Because when we focus on the function of our body, then we are able to appreciate more the things our bodies do for us versus the way that our body looks, right? So if you spend time thinking about the fact that instead of your stomach being, you're unhappy about the size of your stomach, right? But focusing on the fact that, your stomach or that region of your body, houses and protects some of, the vital organs that your body needs, right? Thinking about the fact that if you're unhappy with your skin, think about the function and the fact that, the skin being one of the most important organs that our body has. So focusing more on the function of your body as opposed to the way your body looks is also another way to start appreciating your body more.
Thank you very much. Ike.
Yes.
Esther Nwekina, she says, sometimes I look into the mirror and I ask God why. Now, the conversation we are having now, how can she build that positive, in addition to what Carol has said and her statement that she's made? What advice do you have for her?
Yeah. So I think that Dr. Carol has touched on the essentials, tracing, the source. Where is this coming from? And redefining yourself. That redefinition is based on your own self-perception and not based on what others are saying. So, for example, if someone says you're a fool and you feel like you're a fool, it may not be because they said you were a fool, but because of your own perception about yourself that you're a fool. So someone may tell you you're a fool, but if you don't see yourself as a foolish person, the impact of whatever they said won't be as great as it was meant to be. So for me, for example, I am handsome, whether you accept or not. So when someone tells me that, when someone tells me, oh, you are not handsome, I know I'll say that's your business. I am handsome, right? So your perception about yourself is more important than the perception other people have for about yourself. So redefining who you are. In that redefinition, you need to see yourself beyond the limitations because you are more than the limitation. So people have genuine stigmatizing, physical conditions, right? So someone may come and say, oh, I lost my limb. And that is a physical kind of limitation. But people define themselves by those limitations. They define their whole existence by those limitations. And she said, what are you saying? And I said, you are a beautiful person. You are a very resourceful person. You are a talented person. You are very, very gifted in many ways. You are intelligent. So people can define their whole existence by their limitations. And that has to change. You are more than your condition. And so you cannot define yourself by your limitation. And that is why now, even in healthcare sectors, we are changing some usage of certain words. We don't say a disabled person. we say a person living with a disability. We don't say a hypertensive patient. We say a person living with hypertension, because people are more than their limitations, and people have to define themselves, beyond that. Then again, people should identify and focus on their strengths. When you know who you are and you focus on the strengths and the positive things about your life, the negative things actually lose, weight. You tend to lose sight of the negative things. So focus on your strengths. And really, when you magnify your strengths, you realize that those limitations are even not important in any way. So identify your strengths and focus on those strengths, and be a better version of yourself. Instead of wanting to be a photocopy of another person, be a better version of yourself, through self-improvement, personal development and stuff like that. And sometimes it's really not about who you are, but how you present yourself. That is important. So why not learn to dress well? It's really not about your size. It may just be about how you appear, right? So you may have to be a better version of yourself instead of a photocopy of yourself. Those days, I even remember myself, the way I appear. When I show you a picture, you'll be surprised. But now I learned to be a better version of myself. And I look better. I look good, right? Not because I had an identity problem, but sometimes you just have to improve on you as a person. You may be an elderly person, but you know how to dress. You may be an elderly person, but you know how to present yourself. I think those things are even more important than even your who you think you are in the first. Then finally, maybe I'll add that there is something in psychology we say positive self-statements. Positive self-statements. And that is when you look in the mirror and you speak to yourself, right? Those statements are very, very important. Positive affirmations, positive self-statements. So sometimes I look in the mirror and say, no, you are a fresh boy.
Charlie, you believe yourself too much. You believe yourself too much.
Whether you agree or not, that is your problem.
But
positive self-statements are very, very, very important, when it comes to improving on about yourself and stuff. These are some of the things. And see yourself the way God sees you. See yourself the way God sees you. Please, a minute. Yes. See yourself the way God sees you. I think that is important. Because He created you, and He has given. He didn't create you to disadvantage you, right? God won't create you to disadvantage you, particularly for relationships and marriage. We're still in February. If someone cannot accept you in your naturalness, that you have to significantly change yourself to be more attractive to the person, it means you were not created for that person. Because God won't create you to be disadvantaged to meet your spouse. God won't create you to be around. There are a lot of women who are changing their body parts in order to be attractive to whoever they want to marry. The moment that happens, it means that you've just, in the company of the wrong person. Because the person who is meant to marry you, they will love you for who you are in your naturalness. That is what I wanted to add.
Thank you very much. So, Esther, you have it. Redefine yourself. Perceive yourself that you are beautiful. Focus on your strength. God created you in His own image. What more do you ask for? He didn't create you to be at a disadvantage. And talk to yourself positively. Dr. Damin,
yes,
there are some comments here. Still talking on these things, because I know that these comments will get you some additional ideas. Mateko Bayu, my father said my legs are like cassava sticks. These were the insults I was talking about. We get it in there and it doesn't go away. But now I'm so over it. Thank you. To a great extent. I wear the high heels he admonished me not to wear. It is what it is. I look a lot like my father, and I was told I look like a man. So I don't like taking pictures due to that. Meanwhile, I'm a woman. So, okay. Anthony Dodu. The three things are centered on self-esteem. That is knowing yourself and be proud of who you are, really are, and be self-confidence. From Tony. If the balance give you. I know him very well. Eunice Mahoney. Women who have their tummy change after childbirth, the aesthetic recti. And being constantly asked if there's another baby on the way after childbirth, like Dr. Atta Nima was saying, their tummy grows big and they are being harassed. Jones Kwesitabo, please, what is the role of parenting style in body image challenges? I feel some people develop these challenges through how parents refer to them when growing and comparing them to other siblings and other children. That's very true. That's our next form of discussion after Dr. Odami makes his top up. Patience, Ejari Kwabi. Social media and the presentation of acceptable body images in recent times is getting out of hand. I couldn't agree with you more, Patience. Eunice Mahoney, women who have their stomach change after childbirth and being asked if they're expecting again, you repeated yourself. Okay. It's true. You look handsome and gorgeous. Ike, beauty says you look handsome and gorgeous. Mateko, having confidence is a huge plus because it helps keep you in good place and ways, and it's attractive. People see it too. Abigail, I am someone who had a normal weight back in SHS, but I began to lose weight when we were preparing for our WASI. And since then, I haven't been able to regain my weight. I have been to hospitals thinking that there is something wrong with me, but no, there isn't. It's been 7 years, and now my mom sees me and asks if I am sick of something and gets me worried. Some even think that I did an abortion and see it as a cause. The worst of it all is from my big sister, whom I'm staying with. She constantly makes me feel worthless with her comments about my body, just because I wasn't like before. Esther, okay, thank you. Nadia, see yourself the way God sees you, naturalness. I appreciate your words, Nadia. How do you deal with these oral fixated individuals in groups in social media? These fakes. So, Dr. Damin, I think that picking up from what what's her name? What Abigail said.
Yeah.
How can we help somebody like that?
Yeah. From what Abigail said, I want to know, okay, that there was the issues here and there. Someone asked the normal, is it about Abigail's question? Abigail Boate's question, that the worst of it is from my big sister, whom I'm staying with. She constantly make me feel worthless. Okay, so my comments, you see, there's a statement that we normally say that charity begins at home. So what we tell our children, what we tell our siblings, the comment that we tell them has an impact on their self-esteem and their development. So these negative comments, you are too fat, you are too slim, you are too skinny, you are like this, you are like that. In fact, honestly, I was in a therapy room with a family, the mother, the father, and the child. And the mother had an issue with the father, and in the therapy room insulted the child But the way he did the insult, it was more for the father, because he told the child that you think it's all papa. You see, telling a child that his head is big like the father, in itself, a very, very bad comment, and it will affect the child's self-esteem. So you realize that most of us, the kind of environment we find ourselves in, and the kind of things that people tell us, it's not only on social media. You can decide to be off social media, but the home environment itself contributes to these things, where people feel worthless, people feel useless, and the rest. And I also want to comment on someone's question that he talked about the parenting styles, because realize that we can't talk about the family and not look at parents and the role that parent also plays in terms of body image and self-esteem. So you see, a parent's parenting style has a major impact on the child's body image and their self-esteem. So the way the parent talks about the child's appearance, and even sometimes some parents may even compare their children with other kids in the environment. And it all tends to affect them. And it makes the child to feel insecure. For instance, if the parent is authoritarian, is an authoritarian parent, where the parent is so strict, you tell the child, why do you look like that? You should be more like your siblings. Your siblings are always happy. They are always playing. And only you are like this. You need to lose weight. You see, these criticisms and this comparison, when the child grows up, there's a lot of hatred in their bodies. And they will seek external validation. But you see, the question is, you are you. And that is enough. I can't be like someone, and you can't be like somebody else. And some parents who are very, very pessimistic, where they tell their children that they have to eat certain kind of food, do certain kind of exercises, and the rest. And this can even lead to body neglect, because the child will be so much over concerned about their look. And some parents who are neglectful, it's another style. They are emotionally distant from their children. They ignore their children's or their child's emotional needs. So if the child has a problem, they can't even approach their parents, because if the child tells the father or the mother that I even have this problem, the first response will be an insult to the child. So all these things are parenting styles that tends to affect the self-esteem of children as they grow. So we have to deal with these hurtful comments, even from friends, old friends, and the rest. There are some people who don't want to go for old school meetings and gatherings, because once upon a time, there was a negative comment that was passed on the WhatsApp platform or was passed to them concerning their body shape or the way they look like, and it is still affecting them. And you see, sometimes I always say that if you believe in something, you tend to exhibit it. If you think about problems, you will get problems. If you think about blessings, you will get blessings. So if somebody has passed a negative comment about your look, that you are cute, or you are tall, or you are slim, and you are like this, and you accept those kind of things into your spirit, indirectly, you have invited those things, and you'll be exhibiting it. But if you have a cognitive restructuring, because if you look at the chat room, somebody talked about how cognitive thoughts and distortions tend to affect us. It is true. And what Dr. Isaac said, you see, we need to have positive affirmations. The way you think about yourself, how you handle people's comments and statements. In fact, in the course of the discussion, I was asking myself, those who tell us we look ugly, those who tell us we don't look like, to what extent are they perfect? To what extent are they? In fact, are they also the most prettiest in this world? I want to use this platform to say that nobody is perfect. You don't have a perfect human being. You can't be perfect, but you can be a better person of yourself. And you have to appreciate yourself. If you appreciate yourself, you see the goodness you have. You can't be like somebody. We can't all be fair. We can't all be dark. We can't all be tall. We can't all be cute. And that makes God beautiful. We all come in different shapes and different sizes. And that's the beauty of nature. So please, charity begins at home. The family has a role to play. You realize that most of the comments that we have put on it in the chat room, there is a root cause. And the root cause most of the time may not even be from our friends, but from the family. So I believe that family members, friends, the community, and the rest also has a role to play when it comes to our body image and how it affects our mental health. Thank you.
Thank you very much. Thank you. That was Adonis, you are welcome. I've seen you. Dr. Carol, now I want us to do a bit more of parenting here. As parents, we need to take care of our children because from our discussion so far, developing poor image and having that perception more often than not starts from childhood. And I mean, research have told us that, I mean, females between the ages of 10 and 16, that's when their image worsens, their self-image worsens. Okay, so as a parent, in what ways can we help our children to develop positive body image about themselves? Dr. Odami was ahead of us, so, but I mean, God created us in his own image and we are all beautiful in our own way. So as parents, how do we deal with this aspect, making sure that our children develop positive body image of themselves?
Absolutely. I think that's a great question. And we all know that, parents are the most or one of the most influential role models for their children, right? And parents can encourage children to feel good about themselves, feel good about the way they look by, for example, first and foremost, leading by example and showing them how it's done. Because we also know that developmentally, children catch more than they are taught, right? Children learn when you model things for them. So they are constantly watching, and more than the things you tell them to do, they are also watching what you do. So the first thing I'd ask parents to think about is, are you modeling a positive body image, positive relationship with your body for your children to see? So reflect on your own relationship with your body, right? And try and get a good sense of, okay, what are the ways in which I'm showing up around my children that they might be picking on, right? I was working with a family, and the teenage girl was struggling with anorexia. She had really poor body image, and in working with the family, we found out that her mother necessarily wasn't saying mean and horrible things to her, but the girl her whole life had been watching her mother have a very unhealthy relationship with her own body. Right, so her own mother had anorexia. Her own mother would eat and then purge and throw up. She would hear her mother make comments about her own body, right, and how she needed to be thinner. So it wasn't that her mother was doing anything to her directly, but this child was just watching how mom herself was treating herself, and she was learning from that. So it's important that you are leading by example. What is your own relationship with your body? Work through some of the own issues you have when it comes to your body. Be intentional about the conversations you're having that your children can hear, the comments you're passing about your own body, when you're talking about other people, the comments that you're making. It's important that you are leading by example. When it comes to helping children build body image, it's also important that you get your children having habits around physical activity, right? Because when children feel good about their bodies, when their bodies feel good, they tend to feel better about their bodies. So it's important that you make sure that your children is getting some level of physical activity. It can't be that on a weekend they are indoors playing video games the whole weekend, or you allow them to watch TV the whole weekend, every evening. Be intentional about creating a habit of physical activity and health in your home and with your children. Find a team sport that they enjoy. Get them involved in different physical activities so that they are healthy, and it helps the way they feel about their bodies, right? And then it's important that you also help them to feel confident about themselves, a strong sense of identity, like we've established, and self-worth, right? They are crucial to how kids feel, not only about their self-esteem, but also their body image, right? So talk to them about their bodies. When they have questions about their bodies, answer those questions, right? Don't shy away from those things. Don't make certain topics taboo, right, for them to talk about. Don't label them as bad children when they have come to you with questions about their bodies, questions that then definitely, like we've established, the way you speak to them about their own body is important, right? It's important that you're not insulting them using different body parts. Even jokingly, you know, we use the phrase obolo a lot, like in a very joking manner in this culture. But you talk to people in their adulthood and they've carried that with them for a long time, right? So how you speak to them is important. And then also, like we've just established, being proactive about, you know, teaching them positive things about their body. So encouraging them to speak positively about their bodies, encouraging them to affirm themselves, encouraging them to know what their identity is, and the image in which God has created them. You know, teaching them not to compare themselves to other people, teaching them to know what their strengths are and what the function of their bodies is and their ability to appreciate those functions. And then obviously as they get older, being also intentional about how much access they have to social media. And even when they do have access to social media, teaching them to use and engage with social media in a healthy way, being intentional about, okay, what accounts and who are they following, and based on that, what kind of things are they being exposed with. So I think it starts with you leading by example, and kind of like showing them what kind of body image you want them to have based on how you are kind of carrying yourself, involving them in physical activity so their bodies are healthy, so they can feel good about their bodies, and then also just being intentional about that identity and self-worth. It's encouraging them, affirming them, and then also, you know, being intentional about the things that they are exposed to. I think there are a couple of things that they can do.
Thank you. Ike, are you there? Hello,
Yeah,
Ike.
I'm around. I'm around.
Okay, good. Okay, so before you come on, I know you have something to add, but let me read a few comments here before you come in. Felicia, Sapon, if appropriate yourself, it makes you confident. Nadia, how do we deal with these oral fixated individuals or groups in social media, the fakes? Richard Essel, fake life, especially from social media, also adds up to the challenges people these days, the unnecessary pressure people give to themselves. We need to practice self-love always. Reality therapy. Spouses should stop judging the partners as if the world is coming to an end. We must do everything with love and heal this hurting world. Nina Blankson, as someone who people constantly mimic my voice, make fun of it, and even go to the stand of calling it fake, and equivalent to a bird, how do I approach these people? Do I have to talk back to them or always fold back and shy away from people with a fear of people making fun of my voice? Ike, from where Carol ended, continue for us, bringing into perspective what this lady is saying. I mean, all these things are things I think that she's experienced it right from childhood to this point, and it's still bothering her. So as parents, how do we build that positive self-image? Please take over.
Okay, so just to add to what Dr. Carol talked about, It starts from every stage of the child's development, right from even what you breastfeeding. Breastfeeding starts emotional development of a child. When a baby is neglected by the mother, it actually develops into some poor emotional, well-being as they age. So something like breastfeeding is not just the breast milk. The interaction with the mother and also the father helps with the development of the child. Play. A child that is not playing is a child that is not growing. Children learn, pick up vital, life information while they play with other kids. So now kids are not playing much well enough with other kids because of gadgets and stuff like that. So parents would have to ensure that kids are having human to human contact through play. It helps with the development of other forms of intelligence that helps with the function of an adult. Then again, to choosing one child over the other destroys a child's mental well-being. So sometimes a father would choose the firstborn, mother chooses the lastborn, and the middleborn, nobody chooses them. That can really damage them. And sometimes parents choose kids with special qualities. So you have a child who can sing, is smarter, or plays football and something, a quality that the parent likes. They are likely to treat that child differently than other kids, and that can impact them significantly and all that. So some of these things that we talked about, abuse, physical, verbal, emotional, sexual abuse, actually damages a child. So these are some of the few things that I want to add to what Dr. Carol talked about. Thank you. Then probably let me just add also a parent not allowing the child to become what they were born to become, but forces them into things that they are not, gifted in. So every child growing up has a dream, has a certain perspective about how life should be for them. And sometimes parents force kids into professions and to things that they are not cut out for. And that affects their perspective about life and about themselves. Particularly in the adolescent years, instead of dictating to the adolescent, you need to discuss with the adolescent, about their goals in life, what they think about their own choices and stuff like that, and serve as a source of guide even for that adolescent child, instead of trying to dictate to the child. Sometimes the parents say, so long as you live under my roof, you do what I say. And that is not helpful enough. Particularly in the adolescent years, you should be more discussing instead of dictating all the time to the adolescent child. And so, Dr. Atta, that is what I want to add. Thank you very much.
Thank you, Ike. I mean, that's quite informative. So with regards to Nina Blanson's comment about she being teased of her voice, and she said, do I always have to talk back at them or always fold back or shy away from people with a fear of people making fun of my voice? Nina, we've said it. You have identified the source of this problem. Redefine yourself. You have other strengths that you can build on. See yourself as a better person. Positively talk to yourself. Let me leave it to Ike to just top it up.
Yeah, so we are unique, and in that uniqueness is a gold mine. For example, I talk. I can make you laugh the whole day, right? And that is a gift. So if you put me on stage, that is my gift. And so instead of seeing it as a negative quality or something that is a source of some form of abuse all the time, see it as a gift that you can even explore, to be able to maximize who you are and what you can offer to the world. Because every disability is a gold mine. There is this guy, you can search him, Nick something. I think he's an Australian also. I've forgotten where he comes from. He doesn't have arms and legs, and at some point, he actually went into public speaking and stuff like that. And people only come to see him just because of, that disability that he has, physical disability he has. And it is true that is actually making impact around the world. Now he's married, he has kids, he can swim now, he's even learned how to drive with no arms and legs, right? And so see it as an opportunity to express yourself better and to use that as a tool even for impact. And I'm sure you should be fine. about it. Thank you.
Thank you very much. Thank you very much, Ike. Ladies and gentlemen, at this point, if anyone has a question, the floor is open. Just raise your hand. I would identify, then ask you to unmute. And please, I have posted a link for us to collect your perception of this particular program. Kindly respond to it. It will take you a minute or two to respond to it.
I'm wondering if it's okay for me to contribute. Hi, can you hear me?
Hello?
Hello, can you hear me?
Yes.
My name is...
Please introduce yourself. I didn't...
Yes, my video is on. I don't know if you can see me as well. My name is Robert Gardner. I'm a journalist from the UK.
Okay.
Thank you for this forum.
Go ahead, please.
I'm a generalist, a family doctor. Can you hear me?
Okay.
Sorry,
yes,
can you hear me? Yes.
We can hear you. Please go ahead.
Yes, thank you. And thank you for organizing.
Yes, we can hear you. I can hear you loud and clear.
Thanks for organizing the forum. Just a few things that I wanted to add to what your invited and distinguished speakers have already said. So, for instance, on the note of this lady who feels or is being teased for her voice, one thing that sometimes can help is to acknowledge that there are certain things we cannot change. So, for instance, that is your voice, your God-given voice. Are you able to do something about it? No. Or at least not in the interim. Are you going to allow someone to dictate or to determine what your voice should be? The answer is no. So it is a matter of sometimes exposure and being confident. Sometimes confidence doesn't have to come from another person. You yourself understanding that this is the voice that you were born with. You are an individual, you are unique, as one of the speakers already said. So you have to build the courage. Yes, it is true, parents have to help you with that, and perhaps your environment has to help you with that. But there's a lot of bullying going on, be it at home, among siblings, being at school. You will be surprised how cruel some of our students are. They will pick on a person to bully them just because of their own, let's say, inherent insufficiencies or deficiencies. They want you to be made small so that they will feel better.
I cannot hear.
I think you've muted your mic, sir. Your mic is muted.
Oh, I'm so sorry. Okay,
Yes.
sorry. Yes. So I was saying in address to the young lady who mentioned that she's being bullied because of her voice.
But I think your point is well made.
Okay.
I think your point is well made, unless you have an additional point. But I think your point is well made, because asking yourself these two critical questions, you can't change it. There is nothing you can do about it. And so you need to be confident with yourself. I mean, this thing has been re-echoed, so you've made your point very well.
I wanted to dwell...
Mr. Gardner, thank you so much for your point.
Thank you. I had a couple of points, if I'm allowed to.
You go ahead.
Yes,
go
so
ahead.
body image and body mass index. I know one of your colleagues mentioned earlier that, especially in their clinics, they dwell on it if it is affecting your health. It's important as well that we acknowledge that, for example, if you are in a family where, let's say, your mom and your dad are endowed with weight, or let's say they are big, to put it bluntly, there is a risk that you may also come across that way. So for such individuals, for me as a general physician, I'm not going to sit and wait for them to become, let's say, to suffer general health before I address it. There are ways of presenting the same thing. So I'll explain to them by saying that there is a weight that is healthy for your individual height. It's the same way as expressing the BMI. So for your height, a weight of maybe 5 kilos less would be better for you, because beyond that, there is a risk you may start developing adverse health issues. It may be with blood pressure, it may be with, let's say, kidney issues, it may be even with cholesterol issues, etc., etc. So just to draw the person's mind onto it, that there are things that we can do. So that I thought I should bring across. And then, yes, you've already echoed on the platform that a lot of things you see on social media is not what is actually in reality. Anybody showing you six-pack on social media, they never did that exercise or diet or whatever alone. They do other things. Others are actually on drugs to achieve that. So don't fool yourself by following them. And one thing which might help, especially from parenting point of view, cultural issues come through a lot. For example, in the past, we used to say when your wife is big, then it looks like it means you are looking after them well. Meanwhile, these can also have adverse effects, because you can have a pregnant woman who, to please her husband, is eating maybe 3 meals in the morning. Obviously, this can have an impact even on the baby being born diabetic because of excess weight. So cultural issues do have a role in this, and education is what we need to do, including perhaps in our secondary schools, to instill confidence in the children, because they are our future. We need to educate them that you are good as God created you. Hey, God has a sense of humor. Otherwise, look at the person next to you. They are not like you. They are different. You are different. You are unique. So build that confidence, and we need to instill that in our children as they grow, so they do not allow themselves to be looked down or put down by, let's say, Europeans or Americans who have, let's say, more data so they can stay the whole day online thinking they are productive, but where's productivity? Thank you.
All right. Thank you. Thank you so much. Thank you so much, Mr. Gardner. I don't see any other hand. Okay, I see one hand. Mr. Gardner, that's your hand. Okay. Let me quickly read a comment from Sharon. And please don't forget to fill in our questionnaire for us. It will take you a minute to do that, please. Based on that, we are able to improve upon what we are doing. So I'll plead with you to, as we are responding to the questions, you kindly respond to that too for us. Joanna, there will be a recorded version on YouTube, hopefully by Monday, so you can check it out. Then you can subscribe so that anytime we upload something, you can get it. Sharon Kwashi, the seemingly choice of a particular child is difficult when you have one child with special needs. The others now tend to feel left out. Meanwhile, they are stressed trying to handle the one with special needs. Very true, Walanyo. Please respond to Nina. I think somebody have shared a link for you. Lady with Voice Challenge. Kindly listen to Terry Foy. She also has a child's voice, but she is in her 50s. Roy Clotte, this has been very informative. Please, how can I access the recording? Roy, it will be uploaded onto YouTube, hopefully by Monday. So my final question to my facilitators. So then you make your final comment. So we all have one flow. Respond to the final question, which is that, is there professional help for body image issues related to mental health? When we responded to that, then your final comments about the whole program, then we can wrap up. So let me start with you, Dr. Dami.
Thank you very much, Dr. Atta. Yes, the answer is yes. There is professional help for body image issues. So if you are a person or an individual and you are struggling with poor body image or poor self-concept or having a very low self-esteem of yourself, you can see a clinical psychologist. so that the psychologist will help you with self-assessment and other mental health issues that are related to the way you see yourself and the way you think others see yourself. And again, you can also see a nutritionist who will advise you on healthy eating. You see, all our discussions have been on certain parameters where people would like to embark on extreme dieting or extreme exercising or plastic surgery addictions and the rest, doing all kinds of things, taking medications and all what have you. So I would advise that there's professional help. You see a psychologist, you see a nutritionist, and again, sometimes too, there could be support groups that you could also join if you have that opportunity, that people also will share their experiences and you learn from people how they were able to overcome these body image issues. And again, the mental authority is also helping us. Every month, they come up with exciting topics. For instance, today's topic, for instance, we've all learned a lot. So if you join today's topic, you have been educated. And again, from what Dr. Atta said, it will be recorded on YouTube. So at any point in time, even if you missed any of our recommendations or our comments or whatever we said, you can go back again and play and you get educated. So you can see a psychologist, a nutritionist, or if there's any support group, you can also see. So as you said, my concluding remarks, I believe that as human beings, we have to think positively. We say that, and I always say that words are powerful, words can kill, and words can heal. And having a poor body image can negatively affect your mental health. But with the right mindset, you see, renewing your mind, even as the Bible says, and with good social support and professional help, we can develop that positive image. In fact, as I end, let's appreciate our bodies. You see, irrespective of the way you look, life is more important. And there's always light at the end of the tunnel. Love yourself, be a friend to yourself, and love your body. You get it? And see that you are unique and not just in your appearance. There's more that you can achieve as a human being, and the sky is not your limit. Thank you very much, Dr. Atta.
Thank you, Dr. Dame. Carol,
Thank you. I think with regards to the first question as to whether or not there's help, I think Dr. Adame has covered it, quite extensively. Yes, there's help. Clinical psychologists, depending on what particular issue you're struggling with. There are nutritionists, there are dermatologists, there are, all kinds of health and wellness professionals that can help you together with a clinical psychologist. And support groups and things of that nature. And also sort of like accessing different programs, not only by the Mental Health Authority, but other organizations as well that can help. With regards to my final comments, I will throw a challenge to all of us. I know we talk a lot about, colleagues at work making comments, friends making comments, people making comments. I'd like all of us to also be intentional about the comments we make to other people as well. I think when it comes to body image as a society, we all have a responsibility, right, to be intentional about not only with children, but with, other adults in our workplaces, in our homes, organizations that we are part of, to be intentional about not passing certain comments about the way people look, not putting people down about the way they look, not teasing, not making fun. And not only not us doing it, but also calling out other people who do it, right? So if you're in the presence of somebody and they're making comments, disparaging comments about somebody else, with all the information we've gathered here today, let's also go out and continue to educate other people.
thank you very much. Thank you very much. That's worthy concluding remarks from our panel members. Oh, Ike, I thought you had gone to your meeting, so I was about to run up.
Oh, no, I'm around. Probably quick two things. You're more than your diagnosis. What it means is that whatever you may find as a limitation, there is more to you than whatever the limitation is. And then secondly, just be a better version of yourself instead of a photocopy of someone else. Focus on you, develop you, improve you. And before you realize you are doing so well in life that, the shape of your head doesn't matter. It doesn't matter at all. So try and improve you and focus on the good about your life, about yourself. And I'm sure you should be fine.
Thank you. Thank you for your final comments. On that note, my dear participants, I would say a very big thank you to our panel members, Dr. Odame, Dr. Carol, Matthias Oshes, and Dr. Isaac Newman Arthur. It's been a worthy conversation that we've had today. And so we should take along what we've learned today. If you're having issues, trace the source, redefine yourself. See yourself as the best. Have confidence in yourself. Say positive self-image to yourself. Tell you that they look fresh. Go out smiling. Be confident. See yourself the way God sees you. God sees you as a worthy person, beautiful, handsome person. And that is the way you should see yourself. There are some things we can't change it. So if people are talking about it, that should not weaken your confidence. Be confident with yourself. As parents, we need to communicate the right language. Our comments about body image, we need to be careful about it. We should always be positive. We should engage them in physical activity. We should be intentional about that. We should allow them to express themselves. And so if their ideas are not right, we shape them into the right space. We should instill in them positive self-image. And that way they'll grow up without any issues. And of course, we should manage the kind of engagement and the level of engagement that they have on social media. We need to look at all these things to help our children build and develop positive body image about themselves. On that note, my participants, I say thank you to you and the participants outside the country. Robert Gardner made an informative contribution to it. We say thank you to. And our panelists have said thank you. We've always been there, especially to Dr. Isaac Manata, who I only called an hour to the program. And don't forget to pray for Gloria Igwazi, who got herself into an accident. That's why she was not able to join us. On that note, I say a very big thank you to all. You've made this program worthy. Those of us asking for the link to the program, it tells me you are new. You've missed 35 of such conversations, and all of them are on YouTube. So go to YouTube, just type in caps, MHA Webinar, MHA Webinar. You can add the figure 1 to 35 to 8. So MHA Webinar, the figure 1, not in words, figure 1, 2, up to any one that you want, it will pop up. Just subscribe. So the next one we'll put out, you can easily have access to it. So on that note, have a very beautiful, fruitful, and an exciting weekend. And God willing, same time next month, we'll meet with another insightful and worthy topic. And please, the link, most of you have not filled. I'm looking at my data here. Kindly, please respond. It will take you a minute or two. It will take you a minute or two.
Hello, Doc.
I've reshared the link again. It's to find your perception and any ideas you have about this virtual seminars. Kindly please fill it for us. If you Sharon, your link is very bad, so I can hardly hear you. Please respond to our questionnaire for us. Sweetie Pie, good afternoon. I can see you. Madam Roberta Ashi, good afternoon. Mr. Hanu, good afternoon. Mr. Ferguson, good afternoon. Ephraim, good afternoon. Peace, good afternoon. Hey, Ayera, good afternoon. Felix, good afternoon. Christy Foundation, Christy, good afternoon.
Good afternoon, Dr. Arthur.
Paulina, good afternoon. Stephen, Stephen, good afternoon.
Good afternoon, Doc.
Mr. Kosi, good afternoon. Norbert, good afternoon. Kabran Kansa, good afternoon.
Good afternoon, Doc. How are you doing?
Well, I'm good, my brother. Solo, good afternoon. Hannah, Basic Needs. Greetings to everybody at Basic Needs.